The REMNANT study is a really interesting study. It's the only study really looking at in a homogeneous first-line treated patient population with transplant, taking the MRD-negative patients, randomizing them to treatment with DARA-KD, a very active regimen, at normal relapse progressive disease, or at just MRD relapse, loss of CR, so meaning a very much earlier treatment of relapse, which we don't do today. So the study is presented here because it's interesting, not because the results are there. So for now we only have the part one of the study, the first line treatment. We have included between 300 and 350 patients in that part of the study. We have enrolled so far 120 in the second, MRD negative patients. So it will be in the coming time that the really interesting results from this study will come when we see whether PFS and OS increases by starting relapse treatment earlier. So this is only here because there's a large interest around this study. But unfortunately, the results are still to come.